Good morning, all. Today, we are going to learn an important topic in perio, which is food impaction. This topic is clinically much relevant. When you start practice food impaction, we will have patients with food impaction, and we feel that this is a silly problem presented by the patient. And when we start treating this, we will understand the glitch of it. The reason behind is there are a lot of etiological factors which causes food impaction. Unless you treat the etiology and treat the periodontal aspect of this food impaction, this problem is going to relapse again. So uh, you should understand the concept of the occlusion, the proximal relationship, where exactly the tooth should meet, what all of the other factors, which anatomic factors which contribute to the foot impaction, the alignment of the tooth, the proximal, the occlusal condor of the tooth. All these things are important while treating this patient when they present with this complaint. So let us methodologically evaluate each topic and understand what is the reason behind this food impaction, and let us come to the periodontal aspect of it, how to treat these sequelae of food impaction or the damage causes to the periodontium because of food impaction later. So this topic has to be evaluated or understand from a comprehensive aspect rather than we are constraining our knowledge to only in perio. So let us see how the reason for food impaction is. Well, now let us see what is the definition of food impaction. The forceful wedging of food into the periodontium from the opposing arch of opposing teeth is called food impaction. There are two different types of food impaction. One is vertical food impaction and other is lateral food impaction. Now let us see what vertical food impaction is. When the tooth is not in a proper contact, the tooth, if it is not meeting each other, there is a space between the tooth. And when you chew a bolus, the food is being pushed from the opposite tooth inside this interdental space. The food will get entrapped there and the patient will have discomfort. This type of food impaction is called a vertical food impaction. And imagine there is a recession caused by a periodontal disease, or if you have bone loss, the embrasure space is open up. And when the patient chews the bolus, the food is getting pushed laterally by the tongue or by the cheek mucosa if it is pushing from the buccal side. The food get entangled inside the embrasure area. So these type of food impaction is called lateral food impaction. Well, now let us see what is the sequelae of food impaction. Imagine that a food is getting trapped between your teeth. Initially, there will be a pressure sensation felt between the teeth, and you will have a feel of urge of picking the tooth. So that will be a second feeling after pressure sensation. And if you are not further removing the impacted food, there will be slowly pain will start. The inflammation sets in, and slowly the pain will start. And imagine further, not if you are not removing the tooth, there will be associated swelling associated with this food impaction. Further, if the food start putrefying there, slowly this inflammation will become an infection. Then this infection will increase the swelling, and it forms an abscess, periodontal abscess in that particular area. Imagine this: you are getting constant abscesses in and out. You have many food impaction over a period of time, and imagine you have further many abscesses. What happens is the bone around it will get erode because of this inflammation, and there will be associated bone loss. This bone loss will induce recession, and the periodontal support in the interproximal area will reduces, and further the embrasure spaces open up. This will further leads to lateral foot impaction. And if the food is getting stuck over a period of time, slowly the adjacent tooth will develop caries. So that is also an associated feature or sequelae of food impaction. Now, suppose if you want to treat the patient with food impaction, you should understand the etiology, the mechanism of how the food is getting incorporated between the tooth. Once you understand the basic etiology and etiology based treatment modalities, if you institute, you can treat these patients effectively and efficiently. Now let us see what are the different etiological factors of food impaction. One, the reason for food impaction, it could be an anatomic variation of the tooth. So suppose if you have two tooth which is approximating each other, and if there is a space between these tooth because of the lack of condor, flattened condor, it could be one reason of food impaction. The other reason for food impaction, it could be a faulty restoration, which is, or a fractured tooth which is in the placed in the interproximal area. The third reason for food impaction could be a prosthesis, which is not having a proper contact relationship between the adjacent tooth. And there is a fourth etiology for food impaction is an implant related etiology. Let us see each different type of food impaction etiologies further. Well, suppose if you want to treat this patient of food impaction, one should understand the proper anatomy and the contact relationship of each particular tooth as well as the entire dentition. Now let us understand where exactly the contact point meet each other. Ideally, we need to restore this contact as similar that in a natural dentition. Now one should understand where exactly these contact point meet. Now from the anterior region, when you see the contact area between two central incisors meet each other in the incisal tip, and the occlusal embrasure is very small if it is there. Whereas as we progress to the lateral aspect or to the as you progress distally, the contact area will shift from the incisal region to the incisal 1/3. And as we go further behind to posteriorly, the contact relationship between the premolar and the molar, first molar region, it is between the occlusal 1/3 and the middle 1/3. And further, if you move posteriorly, the contact area is in the most in the middle 1/3. That is for the most posterior teeth. And the posterior teeth will have a surface contact. It is not a point contact, whereas a surface, entire surface will get have a contact so that it prevents the food from entangling inside. And also there will be a positive force which prevents the food from entangling or entrapped between the two. Well, now we understood where exactly the contact area meet each other in a occlusogingival direction. Now let us see where exactly the contact area meet the buccolingual direction. In the buccolingual direction, the contact area is not meeting exactly in the center. It is more lingually placed. So the buccal embrasure will be of a size of a bigger dimension, and the lingual embrasure will be of a size of a smaller dimension. Well, now we will come to the most important aspect of a interproximal area, the occlusal pattern in relation to two adjacent tooth. Ideally, there is a central groove which comes in the mid of the tooth and which ends in a pit called mesial and distal pit. Just distal to the distal pit or mesial to mesial pit, there is a marginal ridge. So when ideally the tooth meet each other, there will be a small V-shaped groove which is present in the, or the occlusal embrasure which is present near the occlusal surface. So this particular pattern will deflect the food from away from the interproximal area, and the central fossa as well as the distal pit accommodate food, and the distal pit deflect the food. This particular pattern of occlusal relationship helps the tooth to prevent the food from wedging in the interproximal area. Well, with this basic understanding, let us move on to the synchronized version, that is the lecture series on food impaction, which we will be discussing in detail regarding the types of food impaction, the mechanism, how does the food impaction, the factors which causes food impaction, and how to detect food impaction clinically, the management of food impaction, and the conclusion of it. So I expect all of you to attend the lecture, and till then, goodbye. Thank you.